So what brought me into Preferred Regen ATL was just the nagging constant pain I was having mostly in my right knee. In the past, the pain would be sporadic, but I started noticing last fall that when I did have the pain, it lasted longer and longer. And it just got to be the point like in February when I was like, okay, I cannot live like this. So I reached out to my neighbor who is a patient here and got the number and called and came in the next day. I have not tried any other interventions before coming in. I did do some research on Google and I looked up stem cells. I looked up steroids, and of course I looked up knee replacement because I have another friend who had both knees replaced, and she's only 58 or 59. I knew I didn't want to go that route. I don't think my pain was that severe, but it was severe enough to feel it daily in a negative way once the pain stopped going away. So the time that I had pain was more and more days, more intense, and it was definitely getting problematic. So my experience during getting my stem cells treatment was superb, completely professional. I was told everything that was going to happen step by step. You're going to feel this, you might feel a pinch. The most that I felt physically during the procedure was the pinch when the needle went in, and there was a point where I was told, okay, I'm going to push the medicine in. I was told, I was prepared, and it was exactly as it was explained. But I'm a chicken, so I had my eyes covered, but at the end, I really didn't need to, but I didn't want to watch. But the procedure, the process, everything was explained step by step, what was going to happen, and everything that I was told happened, and I was made to feel comfortable and reassured that it would be no problem. After getting my very first treatment in my series of 3, I immediately felt better once I stood up. And I was kind of like, is this because everything is new, the medicine just got in? So I would say like maybe the next day, I might have been like 85% better, but my improvement has steadily, the 3 weeks in between where I came and got treatment, it was 85, 95, 100% better each time. So I never had to have any downtime. I never had to take off work. Came in, got my treatment, was able to go right outside and do a short walk. Just knowing that everything that was told to me was exactly what happened is definitely comforting. Oh, my quality of life since getting this treatment has improved 100+%. I have not had any pain. I can feel that I can tell that I'm not at 100%, so I'm probably at 98%, but before I had to take my stairs at home one at a time. I walk up the stairs. Now I could probably run up the stairs if I wanted to, but I don't. But the improvement is priceless because I can do everything. I was doing everything with pain. Now I'm doing everything with no problem. So I would say someone that's considering stem cell treatment for their knee to just do some basic research, look at the reviews, and look at the projected outcomes. I think I would say that what would probably be a hindrance to somebody might be the cost, but you can't honestly put a price on the quality of life that you will have afterwards. And we can't continue to let insurance hold us hostage. So because there are other programs out here that can help you to pay for it or put you on a payment plan, it is absolutely worth it to, invest in yourself and your health. Because if you're not physically able to do the things that you want to do, then what are you going to do? If I could turn back time after I saw the immediate improvement in my neighbor, I would have done it last year, right after she did her treatment. So it wasn't so much that I was waiting to see how much better she got. My pain progressively got worse, and that's when I was like, okay, Bridget, give me the number. She gave me the number, and then she said, he only works on Wednesdays. And when I called, it was like, oh, he has an opening on a Monday. I think I called on a Friday. And I was here that Monday for my consultation, and I had my treatment the next week. And I would do it again.